Greetings, and thank you for joining us on PHA Classroom. My name is Jill Zajac, and I am the Patient Education and Program Manager. PHA Classroom Online Learning is brought to you by the Pulmonary Hypertension Association, and joining me today to discuss the topic of holiday headspace are guest speakers Patrick Mellin and Dr. David Barnum. We welcome you to join us for our holiday mental health series. Today, we will start off with a series that's going to be discussing mental health topics, and we hope that you will find some holiday headspace. Patrick Mellin is an advocate for the mental health community. He is a state trainer, a support group leader, and a speaker for the National Alliance on Mental Illness in New Jersey, and he serves as a board member for his local NAMI affiliate. He also serves on the Community Advisory Council for the Somerset County, New Jersey Mental Health Center. After being diagnosed with pulmonary arterial hypertension, Patrick became a member of the Pulmonary Hypertension Association. He writes and consults on matters with mental health, and he is a support group leader for other patients and caregivers. As the owner of his own IT firm, he also consults for a wide range of working professions. We also have Dr. David Barnum on the call with us. Dr. Barnum is a clinical director at Leonard State Hospital in Kansas. And while he does continue to work in the private practice group Family Therapy Institute Midwest, Dr. Barnum did complete his doctoral training in clinical psychology with a specialization in health psychology at the University of Kansas. After his internship at Temple University Health Sciences in Philadelphia, he has divided his professional time primarily between public mental health settings and private practice. Dr. Barnum's clinical work focuses primarily on pediatric and family psychology, coping with physical illnesses and its impacts, and successfully navigating the challenges that confront us at any step along the way of life.
Thank you, Jill. I'm excited to be with us all this afternoon to have some conversation about how do we get through the holidays and have them be primarily a pleasant, joyful experience and less a highly stressful experience. We're going to talk through a little bit about how that works, the process about how it becomes either stressful or joyous, and see if we can figure out some plan to get through it in a way that makes the most sense as we try to get to those steps. So we're going to try to take a look at some of the things that contribute to stress, some of the things that give us ways to thinking about what are our actual limitations that make it so we can enjoy something more than just feel overwhelmed and exhausted. We're going to look at a few coping skills we can implement. The key for coping skills is the spoiler alert is there are all sorts of fancy kinds. We're going to talk about the simple ones that are right there that you can use right away, because when things are stressful, like during the holidays, that's not the best time to try to learn a brand new way to deal with what's going on. So we'll see if we can remember what those things are that we've done before that work well and tap those resources we have. We're going to talk a little bit about some other resources we might have available and look at some ways to connect with support through PHA and those you might have in other resources in your world. We'll see if we can get through those pieces as we get going. So first, to get some sense of what is holiday stress, for most of us, that's not an unfamiliar term. We have a pretty clear sense. Once you get past the age of about 8, the holidays become a pretty stressful time, and they seem to become more that way as we get older. So we want to get some sense of how that happens, because they weren't supposed to be. We didn't develop holidays just to have a more stressful period in our lives, but they become that. So let's get some sense of how that works. The key is, first we need to have some sense of what stress is, so we can get some sense of why holidays might be stressful. The fundamental piece of stress is that stress is unavoidable, it is inevitable, because it is our response to change. And any changes we experience are stressful, even if those changes are welcome and we like them and they're very good. Any changes we encounter create stress, which means that stress by itself is not necessarily a bad thing. It means that how we respond to it and the ways we think about it, that's what can make it more difficult, more challenging. So as we get a sense of how this might work, we want to figure out how we can make holidays less distressing and more pleasantly changing, so that we can get more out of it that makes the holidays a valuable and pleasant thing to do. So, by their nature, holidays they are by definition a change experience because they require us to do things that are out of our normal routines. We're going to do more social events than we typically do. We have to do gift shopping and wrapping, have holiday recitals and programs to attend. We're going to start shopping for groceries, oftentimes groceries we don't normally buy. Preparing foods we may not normally prepare because they're only holiday foods. There'll be a special piece about what it means when we do things that are only for holidays because those have a different meaning for us. We have to go through and clean the house, sometimes in ways we haven't always typically done it because now it's for a festival, a big event, something where there'll be lots of people there. And as we begin to do this, begin to have more family gatherings, begin to get these elements put together, we develop all kinds of expectations for what's supposed to happen at the holidays. It's supposed to be joyous. It's supposed to be fun. All those things that begin with supposed to, those are all the things that give us the best route to becoming more stressed about how it works. The secret is, actually, holidays all along historically were supposed to be a time of marking a transition in the course of a year. It was supposed to be a time of celebrating something that marked the way we might go for the next step in each given year. So if we can figure out how we can make it more of a celebration, more of marking time in a way that gives us a chance to look back, reflect on things, and look forward in anticipation, that might be a different way than to spend our time almost judging ourselves about how well we're doing with the holidays this time. Have we kept it all according to the way we thought it was supposed to be? Those expectations are the places where we can trip ourselves up. So, as we try to work through how we're going to make this happen, let's see what we can do. As we bump into our non-routine events, all these new things we have to come up with, and make it work. So, all kinds of stressors. This is a great image for emotions that underlie stress. None of those look super happy, except possibly content. But you'll notice that content, probably appropriately in this little chart, is right in the middle of everything else. And the challenge is, how do we get to content when we have to get through rage, scared, shy, suspicious, surprised, anxious, etc.? Well, the secret is having some basic sense of expectation for what makes the most sense to get there. If we know that because it's a different event, because holiday week is a different week, we're going to do different things, be with different people. Some of those people are going to be people we love to have around. Some we have around because we need to. But how do we make this work? Well, knowing that it's going to be a stressful time, maybe we walk into it with a little bit more preparation. Maybe we have a sense that there are going to be things that are going to change in the next week, and we're going to have to roll with that, be a little more flexible with that part. Be cautious about entering the week with a little more with rest ahead of time, because getting through the week might take a little more time than we typically want to give to things. We're going to have to be rested to begin it as best we can. That said, there'll be times, there'll be years when we hit the holidays and realize, oh no, it snuck up on us. We're already tired. I'm already overwhelmed. I've already gained whatever weight I hoped I wasn't going to gain for the holidays, and it's already begun. My body already hurts. I'm already exhausted, and I'm already kind of grumpy at everybody. Well, those are not the things we're shooting for, but they do happen. And when it occurs, our first task is recognizing it and being able to see that that is happening. And so our best chance is, can we stop? Can we just take a moment, take a breath, look at what we want to do differently, see it differently? About 8 years ago, my wife and I became parents to our son. And one of the things that became challenging about holidays was suddenly the stakes seemed so much higher. We had been reasonably pretty well functioning adults, and suddenly we had a little tiny person in our house who made us completely nuts, not because of anything he was doing, but because of what we were doing about what we thought it was supposed to be. Once we finally got to the point where we could realize that whatever we come up with, it's still going to be fun if we can make it something pleasant. And that allowed us to slow down, breathe, focus on the part where we get to smile, focus on the part that we know there's parts of this going to be very good, and be able to recognize that those things happen too. Knowing that everything else is going to happen. We're going to be tired. We're probably going to eat things we would normally eat. we're going to feel more aches and pains. We're going to be a little more irritable, or at least change our moods more rapidly, and be able to be patient with that with ourselves, and then get ourselves back on the track we want to be on. So what are the things that make us stressed during the holidays? Well, the summary is that anything that changes, which is pretty much everything with the holiday, but it's not just change, because change happens every day for most of us. What makes the holidays particularly important is that those changes become especially meaningful. We've decided somewhere along the way in our lives, or even just now, that this time it's supposed to be right. This time it's supposed to be this way. We have all these sort of expectations, many of them we may not have even actually said, about what's supposed to happen for the holidays. Those are all nice goals, but it's a risk to let the desire for perfect to get in the way of your ability to have good. And sometimes good is an excellent holiday, and perfect takes away that part of the joy. We got to be able to find a way. What's that middle ground going to be? What's going to be good enough? What's going to be the part where we feel like, you know what, that was a pretty okay holiday, and we don't have to spend a whole lot of time 2 weeks later taking apart the debriefing about the things that didn't go quite right. When you have those conversations and you follow those big events in our lives, it's curious how a little time afterwards, sometimes it is the little thing that didn't go quite the way it was supposed to that becomes the core of the really important story about what happened that day. The wedding story about who didn't show up on time, or how somebody forgot this particular detail that for weeks and weeks had been the most important thing, and suddenly how we dealt with that became the really important thing. And that can be the same kind of event we have when we have holidays that happen. There's all sorts of expectations, ways it's supposed to go. And when it doesn't go that way, that makes it memorable. Hopefully, we make it memorable and let it become something pleasant to remember. So the trick in all this stuff is, how do we think about these things differently? How do we let ourselves just relax and think about the important part of whatever holiday we're doing is the quality of the experience we have, more than how well we met a checklist of criteria. How many gifts did we have? How accurately did we match the wrapping paper colors to make everything look just right? But the secret is that 20 minutes afterwards, we may not remember that part, but we might remember the part where we all laughed, really, really laughed for the first time in 2 weeks, because finally something funny happened and we could just enjoy that. That's the part we want to hang on to, not the little things that felt so important that turned out in the end were only a little bit important. We start thinking about, how do we see this stuff? How do we recognize when it's happening? Because otherwise it can sneak up on us and we feel like we're a little bit crazy, which is a judiciously used word, because that's really what it feels like. It isn't a judgment. It's just, it feels like we're out of control and things are happening and we're thinking about things we never meant to think about. Well, when we start to approach things that are stressful, we start to see these normal changes in mood and feelings, and then they become much more extreme. We start becoming incredibly angry about things that we wouldn't normally be that upset about. Even if it was important, even if we would normally want to focus some time on it, we wouldn't need to be that cranked up about it. We start bumping into negative emotions that we might typically have, and some of those things are really quite normal, quite typical. But when they start sticking around all the time and they start becoming the most frequent emotional experience we have, that's when we start having problems, because we can't get ourselves to shift out to that normal fluctuation. It's supposed to be that when you encounter periods of stress, we're supposed to have times of feeling good and times of feeling not so great. That's all typical, normal, and expectable. Being patient with ourselves, being patient with others, being patient with those who we love and those who we have in our lives that are important, give us a sense of that's all kind of okay. It's not
So
that there
Dr.
is some.
Barnum,
Yes.
can you speak to the negative emotion that people experience when they are going into a situation, they're newly diagnosed, or they've had this condition, and they might be not feeling as healthy, or they might be having some stress dealing with the physical manifestations of, pH,
You
and
bet.
how that affects them and their mental health?
That's an excellent point. And it's true that any changes to our physical the way we're doing physically changes moving into those experiences, there will be times when we walk into what we really wanted this to be a special year for whatever reason or for whatever way. And we realize as we approach it, we're too tired, we're too worn out. We can't roll with things the way we would normally do because we're just exhausted. And we're not able to recover. And one of the impacts of having a significant medical condition like PH is we end up in a spot where we're tired and we can't recover in the way we normally would. We're just kind of out of gas. The challenge is, can we stop for a second in the midst of that? I'm exhausted, I'm worn out, I'm fed up, and stop that the important part of this conversation around the holidays is really, but I'm here and I'm here with you. And this part, us together, that's the important part. And if I get to be here together and we're awake and we're okay for 30 minutes at a time or 20 minutes at a time or 5 minutes at a time, that's the valuable part. It isn't how all the other details came together or didn't. It's that it's us together. That ability to decide that the most important part about the holiday time is us being together, whomever you're joining with. And for many families, holiday time might be the only time that all these folks get in one place each year. That part is the important part, just being there. Even though as we walk in, I'm tired, I'm worn out, I know I'm in a different place than I was before. Physically, I have things with me, equipment with me I didn't normally have. I need help walking that I didn't need to have before. Those things are changes, and absolutely they're changes, but it doesn't necessarily have to take away the ability to do the really valuable part, which is connecting to those that are important in our lives and that make the holidays an important and special time versus just one more thing we have to do.
I would like to talk to you a little bit about setting your limits during the holiday season when it's especially important to do so. First of all, I want to talk about communicating your limitations and also what's most important to you and how to communicate that to others. The first thing that I think is important for you or for everyone to do, especially for me, I know this has worked in practice for myself, is that writing down the important points that you want to get across. And once you've written it down, bring it with you. Now, I'm sure that many of my fellow PH patients, and as well as caregivers and family, can attest to the feeling of brain fog that comes along with PH. And I know that at times my memory is not what it used to be. So I like to write these things down, have them in a list. And before I go to see or before I go to talk to somebody who I need to say what I want to say, whether it is my caregiver, whether it's a family member, a friend, or anybody who's really in my support network. And doing this, I find that we become our own advocates, and navigating the healthcare system on its own is really its own task, and we need to be able to do that in our personal lives as well. And to do that, especially now in the holiday season, I ask that you try it in two different ways. The first way is don't be afraid to tell people the big word. It's a massive, massive word, I know. It's just N-O. No. You have to know when it's going to be too much or when you need more, but when it's going to be too much, you need to be able to just say no. And that is okay. You have to, I ask that you give yourself permission, especially now when things are getting a little more stressful, that it is okay to say no. There's absolutely nothing wrong with that. And at the same time, being an advocate for yourself. In the second way, you also have to be, don't be afraid, rather, to ask for help. I have found that family members, caregivers, and people around me actually really, really want to help. It's a natural kind of feeling for them. They can often feel helpless when it is a disease that is so impactful on our lives. Other people naturally want things to do, and if you're able to give them a task, say, well, hey, can you go upstairs because I need this, this, and this from the attic? Can you go outside and do this and this? they will actually rise to the occasion, I find, more often than not. Now, the second part is prioritizing your self-care. And for this, my overarching feeling is that I ask you to be compassionate with yourself. When it comes to expending energy that comes with chronic disease, PH especially, you need to know to listen to your body. And when your body says too much, you should be compassionate with yourself and say that it's time for me to take a break. And that is okay. Um, the second way that I have found is helpful is thinking things through. And I mean this in a couple of different ways. So thinking this through with steps. And so by step, I mean when it's a task that is, for example, we're doing some holiday decorating. Well, I know that I need the decorations from the attic. I know that I need the ornaments to put on the tree. And I know the next step and the next step and the next step. So I like to break things down into the steps and even write them down to keep things more organized in my brain. And then the second way is also involved steps, and that's the actual physical steps. If I'm going to be, if I know that things need to be coming down from upstairs or up from the basement, and how long is it going to take me to get to the stairs? How much energy is the stairs going to take? And so realizing the physical effort and the actual things that need to get done, breaking them down into smaller steps is, for me, what I have found to be most helpful, especially now during the holiday season. If you can, work on also identifying what stresses you out emotionally, not just physically. And you can again do this, with your trusty notebook, and it should be a natural thing. Go over your day, go over the last week, and say, what things have gotten me stressed out that I've used my mental energy on. And once you start writing those things down, you'll have a list of what emotionally stresses you out. And as we all know, emotional stress leads to physical stress and will just make you more tired. So please be compassionate with yourself. Know when to say no. Write things down. Break things into steps. And I think that would be a great help for you this holiday season.
I like this point here about prioritizing self-care. I think that one of the ways we often miss in getting ready for and working through the holidays, we'll talk a lot about self-care. We do that a lot in all the conversations around holiday stress. What often gets missed in that is the more subtle conversation about energy. It isn't just about, are you managing stress and getting enough rest? It's really about, you may have less energy today than you had yesterday. And it might be this afternoon it's harder to generate the energy to do what you thought you were going to typically do. And that ability to really respect the signals from your body that I'm tired. So right now, this is not the thing I'm going to do. I'm going to rest, gather my energy, and come back for the best I can. And that becomes very difficult because those extra emotions and the impacts of a chronic disease process really do take a toll on our energy and our ability to recover energy quickly. There's no rush. Having energy and being able to experience something that's important, we don't have to hurry to get there. We just have to be able to be patient and allow it to happen. I think the practicing communicating limitations that is realistic to your loved ones, that's a really good point. That's a whole conversation about how do we gracefully communicate limitations with those who we need to set them. I think especially when we're in the process of having a chronic illness, folks will make assumptions about energy and about the limitations that they can have and that we can have. Sometimes they'll be overly indulgent. They'll try to take care of us beyond the level we want to be taken care of. And sometimes they will assume the exact opposite, that if everybody just pushes and keeps things going, we're all going to be okay. Neither of those are necessarily accurate. And the ability to have everyone slow down and listen to, what do we need? What can I do? What's the limits I want to have so that this can work as well as it possibly can? It's that communication that becomes challenging. and everyone being able to stop the expectations for just a moment, to have a real conversation about what do we want, how can this go, and what do you need, and how do we make that go. And there are folks in all of our lives that their communication doesn't fit for us. Um, so there's, in many families, there'll be those who are kind of the, if you will, the translators. They're the ones who are able to provide communication back and forth between 2 or 3 or more people who just can't seem to get the messages clear to each other. A little bit of patience and breaks can be fine. It is okay. I think it's important to allow us to give ourselves permission that, if something's not working, it's okay to take a break. It's a fine time to decide that I need to go take a break. And no one has to have a whole conversation about what you really wanted to do was not talk to that person anymore for that moment. Take a break, give yourself a chance to relax, give them a chance to relax, and come back to it. Breaks are fine, and breaks are actually necessary. The things that tend to go wrong in families sometimes is when we just won't let each other off the hook a little bit to get some rest and bring back a new thought. That is tricky. So how do we cope? How do we cope with these things to help us where we're trying to get to? We're gonna flip the order of the things on your slide here. We're gonna talk about only controlling what is controllable. The idea is, and there's all sorts of really good stuff out there about how we make decisions about what we can do and what we can't do. The idea is that you can basically, the best you can do in any given moment is we can kind of control things about ourselves. And there are things about ourselves we can't control all the time in the way we want to. So that ability to kind of be a little more patient with ourselves, give ourselves a bit of a break, and to challenge the negative thought process, because we can get to a spot when we're not feeling good, our thinking tends to go toward not feeling good, which tends to make it worse. There's a curious thing about how human cognition works. We tend to be pretty good at worrying. And what worrying turns out to be, we call it the worry dragon, which is a great example. But what worrying really is, it's planning that won't stop. Worrying is a thought trick we play on ourselves, that if I think about it a lot, eventually the thinking about it will make it all better. It actually doesn't. The truth is that if we can figure out how to just worry enough, think about it, build your plan, and stop. And then you can move on to doing it. And then you get to reclaim a whole lot of energy, because the secret is the worry dragon, once you've moved past the part of making the initial plan, each time you go back through that loop again, you're burning about 10% more energy each time you go through it, because now we're adding physical symptoms, we're adding distress, we're adding negative thought processes. All of that takes more energy. Worrying is just planning that won't stop. So once you've made your plan, stop, do your plan. And we'll go back up to the top looking at coping skills and healthy communication. This is a little bit about mindset. So one of the wonderful things about holidays is it's a great chance for folks to get together who maybe haven't gotten together for a long time, people we haven't seen. It draws us to a temptation of, let's review everything that's happened for the last 10 years. Now, not everybody has had a perfect 10 years. In fact, most of us haven't. The trick is, what we're really after is, how do we make right now as good as it can be? And it becomes, how do we stay present? How do we take a deep breath and stay right where we are? Whatever happened before, I'm not super clear that's going to have to be resolved on this Thursday to make it all better going forward. If it's a long-lasting hurt, it probably isn't going to be a one-day fix. And so the alternative is, how about if we just decide we're going to stay focused on today, communicate as well as we can today, breathe, stay focused, stay right here. Notice the things that are happening. Notice the way it feels to be in this experience with the people that we are connected to. What's it feel like to be right here, right now, and not have to worry about what was once upon a time? Those things are past, and they can be dealt with if they need to be at a different time. Holidays are a tough time to try to work out the past. The past has been there before. Let's do the present right now while we have a chance. What do we do? Well, the coping skills you can use, the easiest ones out there, the simplest one, because the thinking stuff we've talked about all the way through so far this afternoon, those are important. But as it turns out, the easiest stuff we can do to cope is actually use stuff your body will naturally do automatically. And there's a couple little reflexes you have that your body wants to be able to relax more often than not. It has a bias toward being able to slow down, let yourself relax, and let yourself calm. And the one that folks will talk about most are things about breathing, but breathing sometimes is a bit of a bind if you have PH. It's a difficult thing to have to stop and tell you to take a deep breath when, yeah, all I want to do is take a deep breath, and that just doesn't work very well very often. So the alternative is, so breathe as calmly as you can, as whatever that's going to be, because the depth of the breath isn't necessary. It isn't the thing that determines whether or not something is relaxing. It is the ability to slow down and simply notice that you are breathing. And that part about being able to be focused simply on the moment right now, that's what breath gives us. The deep breath stuff that folks will talk about, yeah, when you can do it, it does change the way that our bodies feel. But the secret is, and so does stretching a muscle that has been kind of in one position for a long time, allowing your body to sag a little bit when it's time to relax, doing little things that simply change the physical state of your body in that moment, whether that's changing the position you're in, allowing yourself to relax in some parts of your body you haven't relaxed in before, even if it's lightly tensing your hands into fists or into spread open hands, and counting to 8 and then allowing them to just relax into a normal relaxed position, that alone produces a relaxation response that moves through your body and can spread. That's valuable. And the thing that we do when we're stressed is we don't do any of those things.
Patrick, what can you add to this? What coping skills have you found that work for you?
So I have found that there are several coping mechanisms that I have developed over the years that help me deal with stress. So things that work for me personally are meditation. I do like to pray. I like to go on very short walks, journaling, and there are a lot of things that you can do to relieve stress that don't expend a lot of physical energy. And I'm going to talk to you about a couple of them. So the first one that I think that I have found the most helpful overall, in fact, in my entire life, is meditation. Now, meditation does not have to mean sitting in a chair by yourself for hours on end trying to think about nothing. Meditation starts very, very small steps, just a few minutes by yourself. There are a few different resources that I'd like to share with you. Of course, there are all the apps on your phone. You can use Headspace is one that I like. Their beginning sessions are free, so you can start with those. I also like to mention UCLA's Mindfulness Resource Center. We'll get that up on the slide for you as well. That has a great set of beginner, moderate, and advanced set of meditations. And what meditation does for me is, first of all, it grounds me. When I get all caught up in my head, especially in the holiday season, oh my gosh, I got to go to this party, I've got to get gifts, I've got to do this, I've got to do that. I kind of forget where I am in physical state. So putting 2 feet on the floor and really feeling that ground beneath me can lower that stress level for me and even make my anxiety a little better. Some other things that I like to do, I'm a reader. So when I'm going to have a busy day, I'm trying to make sure that I can carve out at least maybe 30 minutes, maybe an hour if I have the time, to just sit and do my quiet reading. That's what works for me. I'm sure that you have something of your own that is similar that will work for you. And I ask that you definitely make time for yourself to do that. Make an effort, please. So, for example, I have used this tool quite often, especially during the holiday season when we have party after party or event after event. When you're going to an event and you are not quite sure either how long you want to stay, if you can stay for the whole thing, or you don't know how you're going to feel, talk to your host beforehand. Either approach them when you first get there, send them an email or make a phone call and let them know that you may be leaving early. It's because you may not be feeling that well, and that they don't have to worry about it, but just so they know. That way, when it comes time for the party or the event or whatever it may be, when you get there, you can, once you start to feel like it's time to leave, you can get your things and make a quick exit without worrying your host.
Another mechanism of coping is using support systems. I'll let Patrick talk to you about that.
Okay, guys. So support systems are some of the most important things in our lives. We need other people to lean on. We need other places to go, and places where we can feel safe to talk about things. And one of those places that I have found is the PHA's in-person support group. They are a place where you will interact with other people who have PH, and you can really learn some things that you're not going to find out from any doctor or healthcare professional. The real tricks of the trade, for lack of a better term, of what can help you, the little things, my oxygen tubing kinks when I go around a corner. How do I manage my water intake while I'm on diuretics? These are things that get brought up at these support meetings all the time. And if you go to the PHA's website, they have a listing and a mapping of where the physical support groups are, when they are. So if you can make one of those, I highly suggest it. And if you can't, PHA has some other great resources. They include a phone network. So we also have phone support group calls, which you are all are welcome on these calls. And they are much like the in-person support group meetings. And they have just that valuable information as well. So if you live in an area where either the support group is too far away or it conflicts with your schedule, feel free to make a call into one of these groups. They are really, really a fantastic resource. And online, we have PHA's online classroom where you can just get more education in general about PH. And there's also PHA's new Facebook group. We have a few different ones that are tailored for individual specialties, I guess you could say, for newly diagnosed patients, long-term survivors, PH men's group. So those are another great place to have support from other patients, and it's a type of support you really can't find anywhere else. Now, aside from just PH support, I'd like to talk about emotional support for just a moment. And in your local community, there are mental health resources. Now, I know that some people hear mental health and think, oh, well, I don't have bipolar disorder, or I don't have schizophrenia, so I don't need mental health resources. But mental health is so much more than that. When you're feeling down in the dumps and maybe a little depressed, or maybe you have some anxiety going on, there are in-person mental health support groups that are also open for you. We'll share some with you. We have the National Alliance on Mental Illness, which I am a member of, and I do a few different things for them. You can go to NAMI, National Alliance Mental Illness, so just NAMI.org, and on there you'll get directed to your state site, and you can look up local support group meetings through them. They also have a helpline if you need other mental health resources in your area that you can call anytime during the day. Now, I also want you to realize the network of support that you already have. All those Facebook friends, all the family that you may have, all the in-person friends that you may have, they're all around for you, especially during the holidays. So when you're either feeling alone or a little anxious or a little down, don't hesitate to reach out to the ones that you already have. Support group networks aren't always about finding brand new ones or searching through the ether to find something that may be out there when you have ones that are already maybe in your cell phone. So don't hesitate to reach out to them as well. Now, I'd like to make a little another comment about suicide. And right now, it is an epidemic in our country. And if you're feeling really, really in distress, and you feel either like you can't fix your problems, or if there is something really, really serious, or you feel like you are in distress, I ask you to call the suicide prevention hotline. Now, before I give you the number, let me just say that you don't have to be in an extreme crisis to call. It is not just a hotline. I know we call it that, but that's not all it really is. It's a warm line as well. It's there as a resource for when you need it. So please don't hesitate to call. Their number is 1-800-273-HELP or 8255. So that's 800-273-8255. Now, also, if you're a more computer or tech kind of person and you're not comfortable talking on the phone, you can go to suicidepreventionlifeline.org and you can chat with the wonderful people that man those lines as well. So please feel free to use it if you really feel like you need to.
So these topics are such important issues to discuss. We know that, a diagnosis with PH can be overwhelming, and particularly as the seasons are changing and we are going to the holiday season, there are additional stresses. And yes, we get to be around family and friends or connect with people, but there are times that can be very isolating or just feel lonely. So we want you to just be aware of the different support systems that are out there and be able to connect. And if that's something that, you can't do, yes, we do have our phone in support group. We have other things you can utilize, but as Patrick mentioned, it is important then to seek professional help by either utilizing and accessing one of the resources that he discussed or seeking a professional.
Thank you, Jill. And one of the things that occurred to me as you were talking about the networks and the support groups and the support line, the other piece that sometimes is valuable, especially as holidays are coming up, is helping the members of your family, maybe the ones who are not currently at home with you, get some information so they know what to expect. Sometimes walking into something new, it is difficult for us as the patients, but it's very hard for folks who aren't around that situation all the time to know what they're supposed to do and what is the appropriate supportive thing to do, to understand what it means when they see an oxygen pack that you carry around with you, that doesn't necessarily mean that there's an emergency underway, and they might need a little help to know how to respond to you and how to be supportive and how to just be them and not change everything because of a health condition that is coming maybe to the holidays for the first time for some of your family members. I think that one of the things that is challenging is how do we know when we need more than just the fantastic naturally occurring supports that we can create in our lives, or finding ways to hook up with those support lines and those support groups. Those are so valuable. That ability to find out that I'm not the only one, that there are other people I can talk to who are having a similar experience. That's essential. We're a very social creature, humans, and we really need that sense of knowing how we fit and where we connect. But sometimes it kind of the demands move beyond us, and what we can how those helpers that are kind of informal, we need something more than that. And when you get to that part where those negative feelings, those things, those distressing feelings, those pains and anxieties and low moods kind of get stuck and they stay with us for longer than we're okay with. Maybe it stays with us for more than a few days or more than a week or two. It's valuable to reach out to find those folks who we can talk to, because there's something a little different about getting informal support from our friends and the people who know us well, and other folks who are dealing with PH in this example, versus those who know a little bit differently about how to help people when their thoughts get stuck on negative thinking, and when we find ourselves in a rut and it just keeps feeling like we slowly sink into it. There's some ways to help us knock out of that, and sometimes that conversation is one you want to have with a professional and not with somebody you need to see when you go home that night. That's support is really valuable, and sometimes the advantage of of professional help is you do it here, and then you can go do the rest of your life elsewhere, and that's really valuable by itself. But when something that's unpleasant is getting stuck, when you feel like you're in a rut, those are times when it's worth reaching out and seeing what you can find in terms of professional help, or when you're finding that the impact on important relationships in your world, whether those are marriages or relationships with kids or parents or whomever, and it just keeps doing the same thing over and over again, those patterns that just won't stop. Sometimes that's the valuable part about finding a little professional help who can give us that objectivity we might need to move us out of that unpleasant groove and move into a better way, to starting to experience what it feels like when things begin to change, and things begin to change in really helpful and good ways.
So we just want to follow up by saying that this is, one of our PHA Classroom series. Obviously, this is on mental health, as we want people to recognize that there's a whole picture involved with, diagnosis, and having PH actually does, actually involve as well dealing with mental changes and mental health and recognizing those things. So we wanted to bring that to you today, and allow you to be able to go into the holidays having some skill set and some knowledge for you to utilize. You can view more PHA Classroom content on our website. There's various topics, from living with PH to pediatric PH. We have videos and webinars about insurance. We have videos in Spanish as well. There's videos for caregivers and family, as well as for yourself. So we do thank you for joining us today. We hope you'll be able to utilize, any educational resources for yourself and for the future. I just want to thank Dr. Barnum and Patrick Mellin for being on this PHA Classroom Holiday Headspace web series. We appreciate your time.